Obviously, each part of Massachusetts is at a slightly different stage with respect to the pandemic. So when we see a statewide drop in patients who are being hospitalized for COVID-19, there are hospitals that have significantly fewer patients and that there are some that have significantly more. But overall, this is a very good sign. Frontline medical workers in many cases have been and continue to work around the clock. And because everybody's been playing their role and doing their part, they have the capacity and the ability to deal with the sickest patients who are dealing with COVID. And we continue to chase down every avenue that's available to us with respect to PPE to ensure the safety of our emergency responders, our frontline healthcare workers, and many of our vulnerable residents. And as of yesterday, we've delivered over 7.3 million pieces of personalized protective equipment, including masks, gowns, gloves, and ventilators. This gear is coming from a variety of places and going to a variety of places, but primarily hospitals, senior facilities, and first responders. As infectious disease specialists continue to learn more about COVID-19, it's clear that this virus is highly contagious and can be spread from person to person without symptoms. And what I mean by that is a significant portion of the people who actually carry the COVID-19 virus never show any symptoms at all, but they are in fact contagious. That means it's possible for a person to infect other close contacts with COVID-19 without knowing that they are infected themselves. We'll continue to do everything we can to expand testing to detect high infection rates, hotspots, and particular communities where we believe we need to be doing more testing. And we continue to arm our facilities with the supplies that they need to test larger and larger populations. And as we've said many times, while we work with the healthcare community to push back on the virus, everyone else has a role to play that's equally important. And as part of that effort, we've already advised that everyone should use face masks or face coverings in public spaces when they are unable to practice social distancing. As we continue to think about the future and a return to a new normal, covering our faces when we cannot practice social distancing is an easy, critically important, and essential step that everyone can and should take to stop or slow the spread. Earlier today, I signed an executive order requiring residents to use a face covering in public places when they cannot socially distance from others. This order does not apply to children under the age of 2 or to people who are unable to wear a face mask or a face covering due to medical conditions or other DPH-issued exemptions. I've also directed the Department of Public Health to issue additional guidance regarding children between the ages of 2 and 5 years old for parents and for guardians. This requirement applies to all workers and customers of businesses and other organizations that are open to the public. The public's required to wear a face covering at all times in grocery stores, retail stores, or on public transportation. The order goes into effect on May 6th. There are several ways you can make your own face covering using items in your wardrobe. It could be made from a bandana, a t-shirt, or other breathable fabrics. Disposable masks are also an option. We strongly discourage residents from using medical-grade masks, as those should be prioritized for healthcare workers and first responders. We've made many requests over the course of the past 6 weeks of this great state, including staying at home, avoiding gatherings, and socially distancing. Our mobility data shows that people have cooperated in many ways to a greater extent than people in practically any other state, if you believe some of the reports that are out there. And it's making a big difference as we fight this highly contagious disease. This order builds on that same idea that everyone doing a small thing all the time can go a long way to improving everyone else's ability to avoid the virus. When folks are out in public places where they cannot social distance, like in stores and on public transportation, everyone needs to wear a face covering for your own protection. Several businesses have already issued similar policies, and so have several municipalities. We view this as common sense and an important way on a statewide basis to establish for the long term a set of standards for what we would call the new normal. I also want to provide a quick update on the expansion of our community health center testing across the Commonwealth. On April 22nd, we announced a partnership with Quest Diagnostics and the Mass League of Community Health Centers to increase testing initially at 12 community health centers. This number will grow. These facilities are deeply rooted in their communities and are committed to facilitating access to care and eliminating health disparities. Quest Diagnostics agreed to ship 1,700 tests per day to centers in Quincy, Brockton, Lowell, Fall River, New Bedford, Provincetown, and multiple sites in Boston. The Boston locations are the Dot House Health Center, East Boston Community Health Center, Codman Square Health Center, and Whittier Street Health Center. Today we're pleased to announce that Quest and the League are expanding to more facilities. In total, Quest is now sending test kits to 18 community health centers. The new facilities that will either start or expand testing include the Lynn Community Health Center, Holyoke Health Center, North Shore Community Health Center, South Boston Community Health Center, the Community Health Center of Franklin County. This partnership is off to a great start. In the first several days, Quest sent out nearly 12,000 test kits, and more are being shipped each day. In a few minutes, it'll be my pleasure to welcome Sue Joss from Brockton Neighborhood Health Center to the podium. Sue's program was one of the original community health centers to join this testing expansion. She's here today to provide an update on how this has impacted her community in the fight against COVID-19. Sue and her team have done an incredible job working with others and especially with the homeless population in Brockton, and their participation in the contact tracing program has been equally important, including hiring multilingual workers to support outreach among their residents. I want to thank you, Sue, for your hard work and the imagination and creativity of your team, and we're grateful to have you as part of our team in this fight. In closing, I want to once again express our sincere gratitude to the hundreds of people from across Massachusetts that have personally reached out to me, to the Lieutenant Governor, and to members of our administration with offers to help and with words of encouragement. We're incredibly grateful for that support and your desire to raise your hand in order to make a difference in the lives of people here in our Commonwealth has not gone unnoticed. I also want to say thank you to the members of my cabinet, as well as to the members of our staff and the Governor's office for the amazing amount of work that they've done day after day after day with no days off over the course of the past 2 months. Those efforts have been tireless and represent the very best of public service. And finally, I want to express our thanks to the members of the media who are assembled here and to those in the newsrooms across the state for showing up every single day to cover this story. It's vital that the public have access to accurate and unbiased information about the actions that we're taking to combat this terrible virus, how people can go about protecting themselves, what's going on in their own communities, and the significant toll that this virus is taking on our people, our economy, and our country. This is a critically important public service that people need, and especially need in a time like this, and can rely on, and I want to thank you all for that. And with that, I'm going to turn the podium over to Sue.
Thank you, Governor, and thank you, Lieutenant Governor and Secretary Sutters. I just want to say you all and your command center have done an awesome job leading us through this crisis, so can't express our appreciation enough. I'm Sue Joss. I am the CEO of Brockton Neighborhood Health Center. I've been there for 26 years. I'm also the chair of the board of the Massachusetts League of Community Health Centers. Our health center serves 35,000 mostly low-income and very diverse patients with large populations from Cape Verde, Haiti, and Brazil. I was thinking back 6 weeks to when we first realized that the surge was upon us. It was a Saturday. We had seen a couple of cases and had started some planning, and we're really thinking about ramping it up over the next couple weeks. But our chief medical officer was working that Saturday, and he called me and he said, "It's started, it's here, the surge is here, the lines are out the door." So I was walking my dogs deep in the woods of Borderland State Park and quickly rushed back home and called our entire team to work for the entire weekend. We immediately shut down our dental and eye services departments, except for emergencies, because we couldn't safely care for those patients, and started scrubbing our schedules to see how many patients we could see by televisits, which we had never done before, and we had televisits up and running within days. The testing rates in Brockton, we had initially a really hard time getting tests, and we were testing only the symptomatic patients, and the positive rates were just incredible. So we have, as of today, as of this morning, 837 of our health center patients have tested positive out of 2,341 total tested. If you do the math, that's 36% positive, which is twice the statewide average. Part of that is because we didn't have the access to testing that we needed earlier on, so we were only thought were the sickest. We launched a collaboration with the mayor of Brockton. Bob Sullivan had only been the mayor for 2 months when this landed on us and on him, and he has stepped up and been the leader that we really needed in this crisis on a municipal level. He pulled the hospitals together and then quickly added in the Board of Health and the homeless shelter and emergency management in our town when it became clear that we were becoming one of the hot spots of Massachusetts very quickly. Our first outbreak that we noticed, that we identified, was at the homeless shelter. We decided to test all of them and came out with 39 positives out of 150-ish tested. And then just recently have done a retesting and added 8 or 9 more positives to that group. So when we heard that the governor was expanding the testing initiative to 12 community health centers, we were just beyond thrilled to know that we were among them, because we knew that with a 36% positive rate, we needed to be doing a lot more testing. So the day that Governor Baker issued that order, we immediately started testing even more patients. And we have a tent on our site in addition to our urgent care department that is now all COVID. And even that we thought wasn't going to be enough. So being one of the first 12 health centers allowed us to work with our collaborators, the mayor and Brockton Hospital Signature Healthcare and the Board of Health and Emergency Management to set up a community-wide testing site on the grounds of Brockton High School. I'm thrilled to let you know that that site opened today. We had just a few patients go through today just as a dry run to make sure that we had all the kinks worked out, and that site will open in earnest on Monday, May 4th, this coming Monday. We'll have 2 lanes. This is all by pre-registration because we do need to screen patients first. But none of this could have happened if the governor hadn't put us as a priority health center to start this testing. So we are hoping to start on that site at about 150 tests a day and quickly get up to about 400 a day, and maybe beyond that if the capacity is needed. So want to thank the governor and your team for allowing us to take care of our community in the way that we think is so important. Also wanted to briefly mention the contact testing program, as we are one of the health centers participating in that. Even though we're crazy busy at the health center, there are some staff that didn't have enough work in their current roles, referrals, coordinators, community health workers, and all multilingual, all rooted in the community. So they were easy, obvious choices to move into contact tracing, and we have 13 staff in the process of joining the state's contact tracing team, so we're thrilled with that as well. I want to finish my messages with just a plea to community health center patients who don't have COVID. We are still open for business. We want to see you. We have a separate part of the building for patients who are not coming in for COVID-related symptoms, and we're doing hundreds of telehealth medicine visits per day. So we, on behalf of all of the community health centers, want to let you know that we're still here and we still want to do business with you. Also wanted to give a shout out to the State Command Center. Leslie Darcy and Elizabeth Larson in particular have been crucial to our expansion and to identifying the issues with the homeless population and quickly finding hotels to move them into where they could be safe and avoid infecting others. And finally, I'd like to thank again the administration. The funding that you put out very quickly to community health centers has allowed us to do what we're doing and saved us from financial disaster that would have happened based on the revenue we've lost with the loss of patients in other non-COVID services. So thank you for all you're doing, and glad to be part of this initiative.
Advisory was sufficient. Why now put this into effect, and also how are you going to enforce it?
So first of all, we've watched and discovered that people for the most part have acted on the advisory the same way that people acted on the advisory we put out on the stay-at-home issue about a month ago. But I think we all believe that as part of the strategy around anything associated with reopening, people are going to need a mask or a face covering if they're going to be close to people. You can't always stay 6 feet away, and even if you can stay 6 feet away, especially if you're inside, you probably ought to have a face covering on. And there's two reasons for that. One is obviously to protect you from others, but just as important is to protect others from you. As I said previously in my remarks, the fact that such a significant portion, still a minority part of the population, but such a significant part of the population that tests positive for COVID-19 will never show symptoms, means that it's critically important that we all accept the fact that if everybody's wearing a mask, it will dramatically reduce the opportunity and the possibility of spread.